Well, we're here at the George Hall Center. They do incredible work helping families and children with mental health. And Bell Let's Talk Day, thank you for Bell and all the support that everyone's given out there. Mental health is absolutely critical. We always say about physical health, but mental health is just as important. Our government has put $3.8 billion into mental health over the next 10-year period with the collaboration with the federal government. So we want to thank our partners at the federal region. But talking to Susan, that runs the facility, George Hall Center here, we need funding directly into these centers. We've increased funding by $194 million. That's on top of the $176 million that we have. But again, that gets spread out to all different areas, which are very helpful. The schools, they do a great job. The hospitals on the assessments doing great. But where the rubber hits the road is in centers like the George Hall Center. And I just want to thank Susan. We have Minister Elliott, Minister Tobolo here as well. It's absolutely critical that we get more social workers on the ground dealing with these families. Susan told me there's up to a year waiting list. In my opinion, that's unacceptable. It's not Susan's fault, but we'll make sure that we get the proper funding over and on top of what we're already pouring money in. When I first took office, we're the first government to have a Minister of Mental Health and Addiction. We're seeing this throughout the pandemic of people having challenges right now, and I just want to tell those folks, help is there. Please make the phone call. And along with our kids too, we have the Kids Help phone. Please just make the phone call and we'll be there for you. And that's my commitment. So thank you, everyone. Please stay safe, and we'll be there to support mental health and addiction. Thank you.
Vaccines. Ottawa released some new numbers. What were those numbers, and how does that react to the?
Well, it's disappointing. Our share of the numbers over the next couple of weeks is roughly about 33,000 vaccines. It's disappointing that now we hear a decline. We're going to be down. I think it's another 13%. Again, I know the federal government is trying, and they're doing everything we can. We need to explore every avenue possible, no matter if it's asking Health Canada to speed up the approvals on the J&J, Johnson & Johnson vaccine, or the AstraZeneca. We need the approval as quickly as possible. Pfizer has let us down tremendously. It's again unacceptable. You know, they have an obligation to meet the contract, and again they've let the people of Ontario down, let the people of Canada down. But we need a loud voice to make sure that we get our fair share of vaccines. It's absolutely critical, and the logistics around getting these vaccines out, and all of a sudden they pull back on the vaccines. It makes it very difficult for General Hillier and the task force table to have proper planning when you don't get what we're expecting to get. So Health Canada, please, we need your help. Please approve these. These have been approved other places around the world. Please share that information and get the vaccines out as quickly as possible.
Now, explain the difference between 5 and 6 doses per vial, and can we assure that we can get 6 doses per vial?
Okay, so if you don't mind, I'm going to bring the Minister of Health in. I saw it yesterday, and we saw a great doctor there with 1 syringe that's getting 6 doses. And when I asked the question to the team yesterday, they have, I believe it's a 3 millimeter. I better let the expert speak, because she'll know a lot better than I will. I'm sorry?
Well, thank you, Premier. Yes, in fact, you can get 6 doses from the Pfizer vial if you use the 1 milliliter needle. The 3 milliliter needle is much more difficult to do, but it can be done. We do have some experts in Ontario who are able to do that. So even if we run short of the 1 milliliter needles, we can still use the 3 milliliter needles, and we're giving guidance to all the people doing the immunizations so that they can get that 6th dose out of each vial. That adds to our load tremendously. It really, really helps us when we have this shortage of vaccines coming in right now from Pfizer.
But when you, rather than talk about doses or what's perceived to be doses in per vial, are we going to have the same number of arms vaccinated next week as we would have had, or are we still going to be short, even though we're getting 6 doses out of it?
Well, we're going to continue with our plan. This won't affect our plan because we want to make sure that we can have all of our vulnerable residents of long-term care homes and high-risk retirement homes at least receive the first dose by February 5th. And we're also holding some vaccines to make sure that the people who have received the first dose will receive the second dose. We need to do that to make sure that they are fully immunized and receive the both doses as they need to.
Okay, so Minister, explain the difference between what we were expecting, and then as of yesterday, we were expecting 20% less. As of the noon phone call, how much less
Yes.
are we expecting from them, and how many arms are going to get vaccinated?
Well, we were expecting to receive 4 million doses to Canada by the end of February, first part of March. We've now been told that that's more like about 3.5 million, so we're short about 500,000 doses. However, we are going to continue with our program. It's not going to affect what we're going to do. We're going to continue to support our most vulnerable. But we are asking Health Canada if there is an approval for the AstraZeneca vaccine very shortly, because we need to supplement those vaccines that we're short from Pfizer. Thank you.
That's right. Thank you.